Hello, everyone. It's Margaret Wallace Duffy, the visionary behind Preventative Health Awareness Month. And I got to tell you, I am so excited to have Dr. Jeffrey Alfonsi, internal medicine, obesity medicine, and lifestyle physician, as well as the co-founder of RxFood. Now, Dr. Alfonsi was kind enough in the inaugural year last year with Preventative Health Awareness Month to do a live webinar, and the feedback then was incredible. He's also been on our podcast and television show, Famcast. He's a really busy guy, and he's here again today during year 2 of Fam to talk about something that he's very passionate about, and that is food as medicine. And this is something that I think so many Canadians don't really think about, and the impact that things like processed and ultra-processed foods have on our health is significant. So Dr. Alfonsi, welcome and thank you. I know how busy you are, and I really do appreciate your time today.
Thank you for having me. It's a pleasure to be here, and thank you for all the work that you've done this month and throughout the last couple of years. It's extremely important. So happy to be here, and congratulations and thank you.
Well, it's because of collaborations with people like you and so many others that this is possible. So let's dive in and talk about, this whole concept of food as medicine and how it does impact our actual health. From your perspective as an internist, internal medicine, lifestyle medicine, and obesity, you see this a lot, and it's a challenge for a lot of people. Where do we even begin, and why should we care?
For sure. I mean, when we think about food is an important part of health. And I do have to start with the caveat. It's food will never fully replace medicine, and there's always a need for that, right? But no matter what you do, whether you're on medication or not, I think food is a very important pillar that we can use to improve our health, whether it be to combat some side effects of a medication or to optimize health or other benefits. So it's an extremely important pillar. And I always talk about this. If we look through our chronic disease guidelines, treatment guidelines that give clinicians ideas on or best practices on how to manage disease, there is inevitably a section on medical nutrition therapy as a key pillar of management of all chronic diseases. And so it is a really important one. And I think it's one of those things that can start, again, at prevention. So really important at prevention, but all the way through to optimizing health or even if you have a chronic disease to optimize some of the outcomes. So I think it's critically important. We've seen, endless research studies on the importance of healthy eating, the value of that. And we've even started to see movements where, insurance providers are starting to fund, meal kits, especially in the States, because there are aspects there. And I know that gets a bit into broader issues that, we probably don't have time to cover here around social determinants of health, which I think is one of the major drivers of it. But we want to talk about the principles in general and ways that we can fit this in a way that is culturally acceptable, that is cost effective, that fits into all those variables that come around food, because, food is one of those things that is beyond just sustenance. It has a lot of elements to it. And so how do we kind of balance that point of something that's acceptable to you, cost effective, and maximizing your health? And so that's really one of the takeaways I hope to get across, is everything is personalized, but really there are ways that you can optimize and personalize how you're eating, and it will definitely add preventative and overall improvements in your health.
Absolutely. And yeah, we could talk for hours, like you said. However, let's talk about that sort of processed foods. I mean, we live in a society where everybody's really busy. They're on the go. Balancing career and children and life and getting kids to appointments and sporting events. And we often, I see it on my tables as a therapist on a regular basis. Kids are coming into the waiting room with, McDonald's in their hand or a bag of chips, which they're calling dinner. Let's talk about highly processed foods and what that does to our physical and mental well-being.
Absolutely. Yeah. I think that's a really important topic. So maybe just as a bit of background on how do we define processed food or ultra processed food specifically. So, if someone does want to learn more, they can look at something called the NOVA classification that kind of has laid out these different levels of processing. But you can think about the example of, we have a whole food. This is something that, nothing's been done to it. And you could use maybe a simple example of an apple is one that I commonly use. And then you could have something called minimally processed. So in this case, you might have a couple ingredients, but not a lot of additives. It might be something like packaged apple slices, for example, that you might get, or even like you may have a little bit more processing, like an unsweetened applesauce, right? So at this point, there's a couple things added, but it's still pretty close to its original whole form. But then we move even further down the processing spectrum, and this is where we get into ultra process. And at this point, we start adding things like sweeteners or a lot of sugars like high fructose corn syrup. You may start getting colors added into this too. And this is where it's the processing here is now adding more things that we probably don't want as much of, like sugar, salt, certain fats, also additives and chemicals that go into it that may preserve the shelf life. And, ultimately these things are put in there to make things either taste better, to last longer on the shelf, and oftentimes to get people to consume more faster, right? And so we really want to be mindful of that high-end processing and what those can do, because the combinations of the sugar, salts, fats that may go in there, we know those can have direct impacts on heart health, on diabetes, etc. They're also seeing more and more links between consumption of more ultra processed foods and higher rates of depression, for example. So linking to that mental health. They may have impacts on our microbiome, which again, the microbiome can have more of a brain gut connection amongst other impacts. And so we really see that we want to be mindful of that processing and what it will do to our physical and emotional health. I do want to step back and say, look, at the end of the day, it's okay to have some ultra processed foods, right? There's some very good things, and people really enjoy them. And sometimes you're busy and you have to have them. So, the purpose is not to say I can never have these. I think the point is just to be mindful that we want to be more aware of the processing that goes in, and seeing where we can shift down into less processed foods in a way that we still enjoy. But that's kind of the first point. I want to just talk through what that processing spectrum is, and also just to upfront say, it's okay to have ultra processed food still, but we just want to do our best to kind of minimize that where we can. Talking a little bit about, and I could probably spend a whole podcast talking about the negative health effects of processed foods, but I think suffice to say that we can, when we've done numerous studies in various populations across various parts of the world, it seems to be that common theme that the people that have higher amounts or more servings of ultra processed foods per day have higher rates of everything from heart disease to diabetes, maybe more likely to gain weight. And even when they look at just overall risk of death, it seems to be higher sooner based on those who have higher consumption of ultra processed foods. So I think that's really the I want to say, if we are thinking about prevention, how do we just shift down to less ultra processed foods, because it will have potentially huge impacts on our physical and mental health. And I think that's really a key takeaway.
Yes, and at every age and stage too. I think it's really important, through the entire month of FAM, we're looking at not just different topics, but through the ages and stages of life. And tomorrow happens to be Healthy Aging Day. And so food, to fuel us and cognitively to help. And, ultra processed foods, I think sometimes we think, well, as we get older, it doesn't matter. And it really does, right? Through whether you're a child or you're a senior, this is something that matters to all of us at every age and stage.
Absolutely. I think no doubt that one of those things, if we see that, making dietary changes and ultimately trying to shift more to that whole food type diet will benefit anybody at any age. And we've seen research studies to show that you're going to get maybe more benefit when the younger you are, and the longer that you're going to have less of that. But at any age, you will get that. And even in terms of how you feel, how you function, right? Maybe perimenopause, symptoms of menopause, like we've heard studies of all sorts of people that within weeks of reducing that, you can start to feel better, and then really change the way that you actually perceive these ultra processed foods. Now, just a bit of a digression here, but what I think is really interesting is, our taste buds, things like our salt and sugary taste buds, they actually get kind of ramped up because we've had foods that may have higher amounts. When you have a lot of processed foods, they may have more salt, more sugar. So you may actually start kind of getting used to that. And when you have maybe a fruit or something, it doesn't taste quite as sweet, for example. But after a few weeks, it could be 4 or 6 weeks, and depending on the individual, you start kind of turning these taste buds over. You've got new sensors there, and then you start appreciating maybe some of those whole foods differently. And then when you start having some of those ultra processed foods, they may actually not taste as good anymore. And I think that kind of gets to the fact that for various reasons, sometime around that 4 to 6 weeks, people start feeling different and tasting differently and really appreciating foods differently. And so at any age or stage, relatively quickly, you can start feeling some great changes to it and then getting all those additional benefits that come with it.
Oh, I love that because it is so empowering in a short period of time when we become aware of what we're eating and how we're eating and the impact it has. And like you said, the quality of our life. It's really important as we age. We want also to feel well while we're aging. And I've seen that so many times with seniors on my table, even the way they're physically feeling. For example, their muscle, not being as sore, and simple things like hydration, which I know you're a big proponent of. Simply taking in enough water can make a difference on the way we physically and emotionally feel. And like you said, in a very short period of time, it's empowering to know we do have that control in our lives without even seeing your doctor, which is really, really important.
Exactly. No, no, for sure. And I think that's the really key takeaway is obviously there's lots of great, professionals, dietitians and physicians that can help guide you, but there's also a lot that you can just start doing and seeing how you feel. And maybe that gets to some of the next things I want to talk about, just some of those tips about how do I
Yes.
become more aware of ultra processed foods. And again, there's going to be some ultra processed foods that you just love, and that's okay. We don't have to cut them all out, but there's many other things we probably didn't necessarily know, or when we look at ingredient lists, there might be things that we can substitute that with that actually are not a big sacrifice, but you've been able to again have a little bit less of that and then gain those health benefits. So I think simply put, the first step is the more you can do shop around, often what people say the perimeters of the grocery store where there's more whole foods. I think that's an easy win if you can add those in that you like. I know fruit and vegetables are getting more expensive now. And so I think I'm a proponent of frozen fruit and vegetables, or in the summer, if you can pick your own or get them cheap, freeze them. That's totally reasonable. I think, a great way to be able to have those fruit and vegetables that are ready and available, right? So doing your best to kind of maximize those whole foods and shopping around the perimeter is an obvious one that probably as people have heard of before, but I think it is really valuable. The next thing is it gets maybe a little more difficult when you start looking at the label itself, but I think that's an important one to start looking at the nutrition label, and the ingredient list is probably more important because the nutrition label can give you some hints. Like, for example, if I always use an example, let's say you're comparing two types of crackers, because you can get some quite diverse crackers, some of them being highly processed and some of them being very minimally processed. You might get a sense from the calories. So typically more processed might be more dense in terms of the calories, but that can fool you. So it's not the only thing that I look for. But what we're going to look for too is fiber. So typically you want more fiber in a particular food item, tends to be better. Again, there are some tricks that the marketers use where they actually add fiber in. So I've seen pop that you can have that has fiber in it. So although it is a component and that's not necessarily bad, but still you don't want to just look at the fiber, but it is one of those things to see about it. I like to look at the sugar. Obviously we want to see how much sugar is in there, and we want to have as little sugar as possible, right? So that's one of the key things, particularly added sugar. I think it's less of an issue with, the natural sugars that might come in milk or fruit and vegetables. And then salt is the other one, really looking at salt. And the general tip that I use for salt is if the sodium is higher than the calories, this is probably a high salt food item. And just the simple fact that, the average adult should have between 2,000 and 2,500 calories per day. And on average, we should be around 2,300 milligrams of salt. That's why you can kind of use that rough gauge of are they about equal? And so those are just going to give you some general tips about the food. But when you look at the ingredient list, that's what is really going to tell you about it. And that's probably the most important part if you're really trying to understand how processed something is. And so just to highlight, the ingredients are listed in order of kind of that quantity by weight. So the most weight or the highest amount is first, and then the least is at the end. But the things that we want to be looking for on a ingredient list that might tip us off to this being more of an ultra processed foods are going to be things like corn syrup, high fructose corn syrup, agave, cane sugar, right? And different dextrose. And so there's a whole bunch of different names for sugars. And so those are going to be the things that, kind of being aware of what those different types of sugars are is important. There's also, you may have some other things added in there like colors. So you may see some artificial colors there. Like they may have like F, D, and C, or yellow number 6, or red number. So these are ones where they've added colors in there, and I try to be mindful of those. There's other ones that may increase like the texture. I mean, commonly you might see things like xanthan gum and pectin put in. And so those are things that can come in as well. And it kind of brings me to a point. I was speaking with a really great researcher in plant-based medicine. And one of his points was, you could actually, if you look at the ingredient list, for the most part, this is going to help you to know that these additives are something that a food is more highly processed. But there are certain things like soy milk that are going to have xanthan gum in it, but it might still be beneficial to have that soy milk. And we don't want to necessarily consider that this is just because it's a more processed foods not to have it, right? So this is where it can get extremely, it can get a bit murky with some of these kind of products that come out like soy milk or the almond milks. And I think in that it might be a better, broader discussion with, maybe a dietitian just to talk through for yourself. Do you have the actual cow's milk or these alternative milks and all that sort of stuff. So I think it's less there, but I think really the takeaway that we want to be looking for is being able to look for things that have colors and sugars in them and really think that these are ones that are probably going to be more processed. And so how can I pick a product that is going to have less of that and still enjoy it? So that's kind of the key takeaway in terms of trying to identify those right foods from the food label. So that's kind of some of the key things that I try to just educate people on, spend a bit more time reading that product label, that ingredient list, maybe looking up a few ingredients to help pick the ones. And you only have to really invest this time for once. Let's say you're just trying to pick a new cereal or a new cracker or something, right? Like you take the time that once and then you kind of know this one's better. You don't have to do that all the time. So it's a relatively kind of short investment for that long-term benefit. So that's kind of the thing. And then where possible too, the more that you have, and this can be hard when people are busy, but the more you can obviously make at home, the better. And I had a great story with a colleague of mine. He's a culinary medicine chef, and he was explaining how he was learning. He was making barbecue sauce with a chef, and they said, "Oh, go get some sugar to put into the sauce for the barbecue sauce." And he got a little container, started putting it in, and the chef said, "What are you doing? You need the big container." And he didn't actually appreciate how much sugar was going into the barbecue sauce until he made it. And so again, now these are ways where the more he can find ways to make it at home, the more you actually know what's in it, and it can also be cheaper in many cases too. So these are, I know that's not always possible for everybody, but even I found ways where it's a great activity with kids. If you're busy, say, hey, let's make something together, even if it's once a week on the weekend. And so all these things get to, can I shop more of those whole foods? Can I make a little bit at home? And can I pick foods that have a little bit less on the ingredient list for those areas that I'm a bit more indifferent on in certain products? Those are going to ways to help reduce that overall ultra processed food intake. And hopefully then you'll start feeling those benefits relatively quickly and can build on that from there.
I love that you're talking about involving the children and getting them to understand that real whole foods can taste good and that it can be fun when we're doing it together. I mean, my kids grew up, I love to cook, and them being in the kitchen, and then when they went off to university and they're learning to cook, I still get the calls, hey mom, what about this or what about that? But they do, it's a real eye opener, and you start to realize what is going into our foods, and that in fact with simple ingredients, whole ingredients, it can taste really delicious and it can be fun to do. So I love the fact that we're incorporating that for the future generations, because over time, when kids are exposed to that young, they're going to live healthier longer. Um, I don't know if there's anything more you wanted to talk about with regards to this topic, because I know you've got patients to see today, but I also want to make sure we cover and talk just a high level about RxFood. What is it? How are you involved in it? Because I think it's a really important technology that many professionals are using, and it can be very, very helpful. But is there anything else you wanted to add before we talked about that?
No, I think this is perfect timing. So yeah, thanks. This is something that's been a passion of mine for about 6-7 years now. And it actually came from a patient and a good friend of mine who both had their own reasons for struggling with food and understanding certain parts of that food. And they came to me when I was in residency and said, hey, can you help us make it easier to understand what's in our food? And so that was the initial idea. And so we put together a very simple prototype where you could take a picture of your food and it would figure out kind of what's in it, the approximate size. And initially we were helping someone with diabetes. So we just said, here's how many carbohydrates are in this so that they could help understand that to manage their diabetes a bit better. And so we actually did a randomized control trial with a research study with it at one of the hospitals and had some really great results. So it was a really helpful thing for the patients. It gave clinicians some new data. And then we had good outcomes in terms of improving both people's ability to understand carbs in their food and overall improve their control of diabetes. And so that was really exciting. And from there, we really kind of branched out. And so now what RxFood is transformed into is really it's a tool that mostly is given out by clinicians. We're starting to have some patients start to use it on their own in different settings. But the idea is that you would just do basically a 3-day photo food log, and it will estimate what's in it, the approximate size, and then it will create some diet quality scores for you. So it's not all about numbers. We try not to say, this many calories here, this, that. Really focus on a lot of what we talked about is, how do we kind of have more fruit and vegetables or have better proteins or less ultra processed foods or healthier fat combinations. So really trying to reflect on the overall quality that individual is having, and then start to give them some tips. So here may be some recipes or substitutions that you can consider to try to make some of those changes that fit for you. And the whole idea is that we think of it kind of like going to get a blood test. You might go and get an annual physical and some blood work done. Maybe every month or 3 months, you do an RxFood 3-day assessment. You get some feedback, you make some tweaks, you learn something, and you think about this as a measure that you go forward for preventative health. And so we've been really excited by that. You can do some cool things like hook up your continuous glucose monitor if you want to kind of see your glucose response if you're wearing one of those. So that's really in a nutshell what RxFood is.
It's such a powerful tool, and I'm really excited I've been introducing it to healthcare professionals, but also the idea of patients, getting into the driver's seat of their health and understanding, because it's empowering, whether, they're dealing with diabetes or maybe they've got osteoporosis, and food plays a really important role in managing or preventing further bone loss, or keeping the bone that they have, because we can start this young, and understanding the role that food can play in the overall picture of our health. I just want to commend you for the incredible work you're doing, and both clinically, but also with things to help the average person, and believing also in the role that plays in preventative health. I'm humbled that you're taking the time out of your very busy schedule to help educate and empower Canadians, and to work alongside of us during this initiative, not just during the month of February, but FAM, Preventative Health Awareness Month, turns into Preventative Health Awareness Movement all year long, because it is a 365-day job. We're grateful in Canada to have physicians like you that we can go to, but I'm sure that you will agree that when a patient can be more empowered, be the...
Yeah, no, I agree. I think 100%. No, I just fully agree. The goal is to empower everyone to be able to prevent health, I'd much rather be sitting here, maybe guiding or tweaking some stuff and focusing on prevention than focusing on, prescribing and treatments. Obviously, that's an inevitable part at some point, but the more we can shift, I really enjoy the conversations about prevention with patients, and it's a completely different focus than talking about treatments, right? And so if I can shift more time towards focusing on prevention because people have more tools, then I'd love to hear that. That to me is very exciting.
Absolutely. And even once someone has a diagnosis, we were talking about this. I know that I had a regional cancer center reach out that was part of FAM this year. And what they're saying is, so maybe somebody has been already diagnosed with cancer, nutrition and many of the other tools we've shared this month is important to help them through the process of walking through a diagnosis of whatever that may be. And that's what excites me about this movement. So I can't thank you enough, Dr. Alfonsi. I really appreciate your time. And I know that this is going to be so helpful for so many Canadians. If they want more information about RxFood, where do they go?
So they can go to our website for sure, and there's forms that can be submitted if you have a question. But the rxfood.co, so just rxfood.co is a great place to go. I think we're on LinkedIn as well and Instagram, so they can go there. And happy to help out where we can. And I think this is an extremely important movement. So I want to thank you again as the mastermind and really moving this along. It's so important. So it's always a pleasure to be here. And thank you again.
Well, thank you. And for those of you at home, stay tuned. You can not only see this video, but also on our blog. Please share this widely. The more people that this information gets out to, the better, and the more we can elevate this movement moving forward for the rest of this year and next year's Preventative Health Month. So remember, everyone, a healthy tomorrow begins with prevention today. Stay well, and we'll see you all soon.